Hi, everyone. I'm Jana Rieger, the host of Enjoy the Life You're Living. And today I'm very excited to have a conversation with our guest, Dr. Ting-fen Lin. She's joining us from sunny Fresno State University. And we're here to talk about dysphagia and breathing and breath work. And I'm just so excited about this conversation, Ting-fen.
Thanks for the invitation, Jana. Very
Yeah.
excited to be here.
Yeah, for sure. For me, probably one of the most exciting questions that I love to start conversations with is about someone's personal story, and really, how did you get from, how did your career take you to where you are now? And just for our listeners' sake, you're someone who's really passionate about dysphagia, and you're passionate about breath work. And that brings in a whole other realm of wellness. So I would just really love to hear your personal journey of how you got from even being interested in speech pathology and dysphagia and how that path got you through to breath work.
Yeah, for sure. I think the story started when I was a graduate student at Ohio State University. That was the first time I came to the States. So I'm originally from Taiwan, born and raised. So I came to the States for my master's training in speech language pathology. The transition was tough. So the language differences, I switched majors, cultural differences. So just a lot going on in my life.
Mm.
And then I noticed that I started to have these physical symptoms like dizziness in the head, stomach aches at times. And at the same time, I noticed that other symptoms that I started to have was like having all these running and busy thoughts in my mind, like going to the lab on time, getting groceries done, getting on to the bus, like life stuff.
Yeah.
And I didn't have all these symptoms when I was in Taiwan. And at the beginning, I was thinking, okay, this is like a trade deal. Once I go through these symptoms, I'll get my degree and things will be hunky dory. And so I kind of just lived with these symptoms for like a couple of semesters or quarters, actually, at Ohio State. It was a quarter system back then. And then my colleague from the same department invited me to participate in this Sky Happiness Retreat at Ohio State. And she said, "Oh, you should come and learn to breathe." And at first, I was resistant to the idea because I was thinking, okay, I don't need to learn how to breathe. My skin is pink. I'm breathing just fine. And then one day, I kind of just gave in a little bit because I was complaining about, again, some stomach ache at the student lounge. And my friends like, "Oh, you should just do this Sky Happiness Retreat. Just give me your credit card." And I just handed my credit card to her, and she signed me up to do this Sky Happiness Retreat. And at the Sky Happiness Retreat, what I learned was a sequence of breath work, um, a progressive program. At the end of the program, I noticed that my mind became clear, so quiet that I could hear that drop of pin. And I also noticed that my like physical symptoms went away. I sleep better. My interactions with others become more natural. I can focus better. It's just that very interesting contrast between the inner peace and outer dynamism. So I continue with the practice. I even went through the volunteer teacher training, so I'm
Mm.
eligible to and certified to teach breath work actually, and meditation. And so I was just so intrigued by this contrast of benefits, inner peace and outer dynamism. And so I started to look into the research behind this particular breath work. And I noticed that there's a lot of science behind the Eastern practice, a lot of Western-based evidence for the Eastern practice. And so um, I just got more and more interested in it. And so as I read through the articles, I noticed that some of these benefits of Sky can potentially be transferable to our populations, the populations that we serve as speech language pathologists. And so that's how this ball got rolling.
Well, that's so interesting. I have a couple questions related to what
Yeah.
you said, but so just for clarification, when you went to Ohio State, was that your master's program that you were doing at that time?
Yes, it was.
Yeah. What do you, when you look back on that, and you had said something really interesting. You said when you were in Taiwan, you didn't experience anything like this, but when you came to North America and were in this program, you did. Like, can you
Mhm.
attribute that change to anything? What provoked that?
Yeah, I'm guessing it's the stress that was accumulating as in a new environment, as a graduate student, as an international graduate student. These different factors, like switching majors, taking on a research assistant role,
Mm,
groceries, and making
yeah.
lunches, and yeah, all these different life factors.
Right, right. And so now for people who don't know what sky breathing is, so SKY, sorry, SKY breathing, can you tell us a little bit about that as a foundation for the rest of the conversation that we'll have today?
Yeah, absolutely. So Sky is short for Sudarshan Kriya Yoga. And I can type it in the chat for you later if that's
Sure.
helpful. And so it's a sequence of breath work in Sky, and it involves many components like breath work, leadership, service, equity, diversity. So there are so many different components within the Sky happiness retreat.
Mm,
And there's a lot of research behind Sky, both the physiological and psychosocial aspects. Research has shown that Sky is associated with improved cardiopulmonary functioning,
mm,
as well as improved reduced anxiety and depression markers,
yeah.
enhanced sleep quality, enhanced social belongingness. And so it's just a very comprehensive and dynamic program. And it's a very easy program because you're just using your breath,
Yeah.
and there are so many other qualities within us that are manifested.
Yeah, yeah. Isn't it interesting that breath work, the practices of breath work come from really ancient wisdom and it's been around for a long time. And it's now becoming validated by the Western world. So, what do you think is stimulating this interest now in the medical world around the curiosity that they have around breath work?
Yeah, I feel like most of us take our breath for granted. We don't notice our breath until we're catching for a bus or we're on a workout, kind of. But breath is so essential. It's life sustaining. It provides us with energy, and it has an intricate link between the inner world and the outer world as well. And I think the biomedics, biomedicine, yeah,
Yeah.
biomedicine has been advanced so well. And so I think people are starting to look into the biopsychosocial aspect through a different realm. That's just my take on this, the budding phenomenon of breath. I feel like in psychology and psychophysiology, they have been looking at breath. And so I think we're starting to borrow some of the research results into other fields as well.
Yeah. Yeah, for sure. And so now if you, I'll take us into our field, which is in the realm of rehabilitation, and specifically speech language pathology. And so I know for your PhD research, you then focused on breath work as it applies to a population. So I'd love to hear more about that, what you studied and what you found.
Yeah, yeah. So I'm gonna trace back a little bit.
Sure.
So when I was working as a speech language pathologist in the acute care setting, I had quite a portion of my caseload was individuals with COPD,
Mm.
chronic obstructive pulmonary disease. And I love my job. I love my job in the acute care setting. But I always feel that there's something I can do to help this population, apart from modifications, apart from education, apart from compensatory strategies. And so it's really that urge that prompted me to pursue a doctoral training in speech language pathology, specifically in swallowing. I wanted to see and understand if there's a comprehensive way we can help individuals with COPD in optimizing their mealtime experiences.
Yeah.
And so that's oh, go
Sorry,
ahead.
I wanted to jump in here because when people hear COPD, they might think just respiratory problem. Can you explain a little bit about what a speech language pathologist would be doing with someone who has COPD around meal times?
Yes, yes. Sorry. Yes, that's a good prompting question. So I did a qualitative study when I first joined my doctoral program, and we found that through interviews with individuals with COPD, we noticed that yes, during the mealtime, individuals with COPD present with shortness of breath. They have trouble breathing at meal times. And these emotional manifestations actually, I'm sorry, these are physiological manifestations of COPD actually trigger some of the psycho-emotional
Mm.
manifestations like panic, anxiety, fear during mealtime.
Mm.
And so these um, psychological manifestations actually trigger more of the shortness of breath. That's
Mm.
worsening the existing compromised breathing status. And so I, um, it's, in my opinion, it's not a good quality mealtime. And so these individuals, my participants also reported that they started to modify the way they eat. Without seeing a speech language pathologist, they would start taking smaller bites, being mindful of the way they eat. Someone even mentioned they started using chin tuck. Then
Mm.
these are all individuals without a label or diagnosis of dysphagia, and
Mhm.
yet they started to implement some of these strategies. And so, yes, perhaps the initial perhaps the first thing that comes to our mind is difficulties with breathing with when it comes to COPD, but um, difficulties breathing can lead to some negative emotional manifestations, and then tanking the whole mealtime experience.
Yeah, so that's interesting. So you're a clinician working in acute care. You saw this in the patients. You wanted to do more. And so then you decided, hey, I'm going to do a PhD. And so tell me, you told us about the one study that you did to
Yeah.
really understand more, because I think it's an area that a lot of speech pathologists and people in general, clinicians in general, don't understand about what are people experiencing, people with COPD, what are they experiencing when they're eating? So that's really interesting. So you learned about that, and then how did that take you into this next step of your PhD?
Yeah, yeah. So given the results of this qualitative study, we know that an individual with COPD is impacted psycho-emotionally, psychophysiologically. The biopsychosocial aspect is impacted during a mealtime. And so I started looking into some of the comprehensive approaches. And I was like, oh, there's one comprehensive approach that I do every day, actually. And so I started to look into how we can introduce Sky to my target population. And so that started the planning of the dissertation study. So what we found was, remember there's that cyclical manifestation that I talked about as a conclusion of the qualitative study. So we found out that with my dissertation, after introducing Sky to the participants with COPD, all the different aspects within that cycle is reduced. So we did sorry, I feel like I'm a little, my thoughts are a little jumping right now. But anyways, so we did a mixed qualitative and single case study. And what we found was individuals with COPD reported that their perceptions of shortness of breath have improved in the realm of work of breathing, shortness of breath, dyspnea-related anxiety, and there's this other factor is dyspnea-related distress, I believe. Anyways, and then so that's based on the modified Borg scale. At the same time, we also conducted interviews with these participants, and they're reporting that they breathe better, they can breathe in better, they can inhale better. They noticed that their recovery after a shortness of breath episode is quicker without anxiety attached. They notice that their energy is better, they sleep better. Someone even mentioned that they feel that they want to live longer now that there's a purpose in life. And so to me, it's a very meaningful quest that I embarked on, finding different approaches to help individuals comprehensively.
Yeah. And then what were the downstream effects on their meal times that you found related to all these really nice changes in the other realms?
Say that again, please.
So you had said that they had decreased anxiety, they were sleeping better, they were less breathless. What were the outcomes in your PhD related to mealtime?
Yes. So thanks for the clarification. So that's what I'm hoping to explore and examine more, looking into the physiological differences before and after Sky. So my PhD dissertation happened during COVID, and so the data collection was limited to interviews and surveys. Now that we're done with COVID, and so I hope to scale up study, looking into the actual physiological manifestations that's related to Sky in a population like COPD.
Yeah. And in general, how did the participants that you had in your study, how did they react or appreciate the sky breathing techniques?
They love it. Someone said, "Oh, do you need more participants? Send me the flyers." And someone said, "Oh, I need to talk to my pulmonologist. They need to know about this." They received the program very well, and they are willing to help share the program even without me asking. And so to me, that's very meaningful. I had this participant who shared that because of their health status,
Yeah.
they weren't so optimistic about life. But then after learning Sky, they feel like they took on a different lens to
Hmm.
look at life
Yeah.
through a more optimistic lens.
Yeah.
And I think that that's something.
Oh, for sure. That's amazing. It's certainly, when you think about just bringing it back to meal times and dysphagia, one of the things that, we've heard from patients when they lose the ability to have normal meal times is this whole impact on socialization, on the quality of life, on their enjoyment in life. And it has a huge impact. And so um, thinking about now where you are with your research, you are taking on a new population that you're looking at, which is head and neck cancer. And I'd love to hear more about I know you've done some pilot work, so would love to hear about the pilot work and then also where you're going with this new, bigger research program that you're delving into.
Yeah, yeah. So I'll answer that question, but something just came to my mind, and maybe
Yeah,
this can be edited in. I remember someone, this is regarding the COPD study, dissertation study. Someone mentioned that before they learned Sky, they were always so nervous about eating
yeah,
because I'm sure they have had some choking or coughing episodes
yeah.
related to oral intake. What they've shared after they learned Sky at the interview is that after Sky, they can just eat and drink without being aware of that they're actually doing it.
Hmm.
So I think that relaxes the system. Sky helped relax the system um, in optimizing some of the quality of life.
Yeah, for sure. And that's definitely something that I know as a clinician I've heard from patients is that you, when you're normally eating, you aren't thinking about it. So you're eating, but you're socializing and kind of that socialization. Yes, you're enjoying the food, but you can also do that and enjoy it. But once dysphagia becomes part of the issues that you are dealing with, all of a sudden now you just have to focus on that physiological swallowing and you can no longer really enjoy that mealtime.
Yeah,
So it sounds like what you're saying with that participant that you had is like what it did for them was it allowed that mealtime and the eating to become what it used to be, which is like, I don't have to think about it. I can just enjoy it.
right. Yeah, yeah,
Yeah.
for sure. Yeah. So coming back to your head and neck
Yeah.
question, should I do it now?
Yeah. I'd love to hear more about that.
We know that head and neck cancer management can be associated with anxiety and depression,
Mm.
decreased appetite, impacted sleep in individuals with head and neck cancer or survivors of head and neck cancer. We also know that the caregivers who are caring for individuals or survivors of head and neck cancer are also impacted as a
Mhm.
result. So, and there has also been research that suggests that when the quality of life for individuals, uh, when the quality of life for the caregivers is impacted, the care recipients is also impacted as well. So there's just that very complex cyclical effect that we've been reading in different literature.
Yeah.
And so what I was thinking was, again, the biomedicine has been so advanced in our field, but then the biopsychosocial aspect seem to be lacking a little bit. And so I was interested to see how we can transfer some of the Sky benefits that have been reported in the past to individuals with head and neck cancer and their caregivers. And so that's that's the another project that I
Yeah.
have right now.
And can you share a little bit about some of your early results from the pilot work that you have been doing with sky breathing in head and neck cancer?
Yeah, yeah. So the pilot was based on surveys as well as interviews. So what we found was without manipulation of swallowing physiology per se,
Mhm.
the E10 scores actually, there's a trend of reduction in the E10 scores, comparing a few different time points before and after Sky. I've had participants who share that they are more interested in eating after learning Sky. They feel calmer, happier. They are not afraid of going out to the public. Someone even mentioned that their neck range of motion and the arm range of motion have improved. And so these are the from the survivors' side. And in terms of
Yeah.
the caregivers, they reported that they feel calmer, more at peace, and they worry less. But they weren't sure if it's as a result of the sky or seeing their husband improving. And perhaps it's a
Right.
combination of a little bit of everything too. And so I'm in the process of scaling up the study to see how we can let numbers speak louder.
Exactly.
Yeah.
Exactly. And so, as part of this study, are you measuring their perception on, again, say something like the EAT 10 to see if their scores improve? Are there other measures of physiology that you'd be undertaking in this study?
Yeah, we're looking into the quality of sleep,
Mm.
the anxiety and depression aspects of life as well,
Mm.
and trying to think, eat 10 and some quality of life measures.
Nice. Oh,
Yeah.
that's excellent. I'm really excited to hear the outcomes of this because really it is multifaceted. When you were talking about the caregivers, I think often, we forget that that they are so embedded into the whole health and wellness of our patients who are going through this, and they're also struggling as well. And so it'll be really interesting to see um, and figure out what some of those feedback loops are in terms of what the effect is of this. And like you said, having a spouse or a partner say that they weren't certain if it was just seeing, if it was helping them or if it's seeing what is happening with the partner. I think that says a lot because it is such it can take such a toll on the caregivers as well. So what I'm trying to say in this long-winded message here is just I'm really happy that you're including them as part of a study into this whole very complicated world of head and neck cancer and the outcomes related to that. So you said early in the conversation, another really interesting thing was that from your own personal perspective, when your friend was trying to get you to go to this class and you thought, I'm breathing, I'm already breathing. Why do I need to learn how to breathe? And it's interesting because that's something that you see often associated with breath work. So, for example, I was watching a podcast that had James Nestor on it. He's written the book Breath. Very great, information in that book about the history of breath work and as well the aspects of how it affects our biophysiology. And what was interesting was people's reactions to it. So a lot of people have that very reaction where, it's like, I'm breathing. Why do I need to learn how to breathe? If someone said that to you, Ting-fen, what would you say back to them?
That's a good question. I'm going to take this question lightly.
Yeah.
We shower every day, we brush our teeth every day. Why do we do these routines every day continuously? Because we want to make sure that we keep the hygiene, right?
Mm.
Similarly, like I was sharing, breath is a very powerful tool to harmonize the inner world. And so looking into controlled breathing or systematic breathing technique can really help up our energy and up our quality of life.
Yeah. So that's a great segue to a question that I ask all of my guests, Ting-fen, which is, what does the phrase enjoy the life you're living mean to you?
The heart is beating in the present moment. Breaths are happening in the present moment. So life is also happening in the present moment. And so enjoy enjoy every second that we have would be what I take out of that sentence.
Well, thank you so much, Ting-fen, for all your insights today. There's some really exciting things in here for not only our profession for speech language pathologists in terms of understanding COPD and the relationship to dysphagia, and also as well as breath work and how that can apply to the populations that we're working with, and with the intent of improving outcomes related to the things, the physiological things that we're interested in. So thank you so much. I really appreciate your time. And I would encourage anyone who knows somebody who has head and neck cancer or is a clinician working with patients who have head and neck cancer to get in touch with you about your study. I know that it is virtual, so anyone in the world can join in here. And what I'll do is I'll put those contact details in the message of this podcast so that people know how to get in touch with you, Ting-fen.
Yeah,
So,
thank you so much, Jana.
yeah, my pleasure. Have a great day.